Staffing issues were a challenge for hospitals across the country even before the pandemic started. So that's nothing new. And so because of that, we've had a number of ways to ensure that we have the staff we need to care for patients. So we can move team members to other parts of the organization. We're always hiring new team members. We occasionally have to use some traveling nurses to fill those gaps, but our teams have done a remarkable job doing that. And so we have not had a major impact with staffing related to our vaccination program. So the patients get the care they need, and we feel very good about that. And I think the mood is good. I think when you think about what healthcare has been through over the last 19 months and what these team members have been through, I couldn't be prouder of how they've come through all of it, including our vaccination program. And to really see how our team members have stepped up and said, hey, the most important thing that we do is keeping patients safe. Our sacred responsibility is to make sure people are not harmed when they come into any of our facilities. And the way we do that is to put every barrier up that would protect them. So that's the use of PPE, including masking and eye protection and gloves and gowns and all the things they put on, but it's also being vaccinated and ensuring that we don't spread virus to each other and to patients that come into our care. And remember, it also prevents our team members, vaccination also prevents our team members from getting COVID. You have staffing issues when team members are out with COVID because they're members of the community. And throughout the pandemic, certainly pre-vaccine, we had team members getting COVID and they have to be out. And they have to be out often for a couple of weeks. And then with long COVID, they may be, have issues much longer than that. So I think people think, well, a small number of individuals have left the organization, so that must create staffing issues. What creates worse staffing issues is when team members get COVID and they're out for longer periods of time. So it's really a balance, but we feel very good about where our staffing is. Yeah, so we always have to be flexible in healthcare and how we do staffing, and so that's just part of how it works. So that flexibility has allowed us to ensure that we have the appropriate staffing. So there's not been a major impact. I mean, look, we have over 35,000 team members, and so to get down to a number of 175 who've chosen and said, hey, this isn't necessarily for me. There's no animosity about that on our part at all, or certainly not on my part. People have to make those decisions. We've just said, as an organization, the most important thing we do is to ensure that patients don't get hurt. First do no harm. It's the first thing you learn in medical school is first do no harm. And we're really passionate about that. I'm very passionate about that. And so that's the culture we've set as an organization. And I will say 99% of our team members have said, we agree with that. And that's what our passion is too. And so it's unfortunate, but again, if 175 people said, look, I just can't do that right now. I need to think through this. I need to do something else. Or I need to move on to something else. That's absolutely their right. But like I said, 99% of our team members are compliant with our process. And we're delighted about that. It allows us to kind of move on here to continuing to care for patients and getting back to what we do best, which is caring for patients. So I don't anticipate a lot more issues with this at all. And I think when people come to work for us now, they already knew this before, that safety was our number one priority. And so they know what they're signing up for when they come to Novant, is that we put patient safety ahead of everything else we do. Yeah, so I would say the vast majority, and again, when you have 99% compliance with your process, the vast majority are in agreement with what we're doing. And social media has a way of kind of amplifying small numbers of voices. We've given a lot of opportunity to ask questions. I've answered hundreds of emails about vaccine safety and why we're doing this and all those kind of things. And so, we've provided all of that education to folks, and we're no different than many other healthcare systems and frankly, many other industries. But again, we put patient safety absolutely first. It doesn't make much sense to me that non-healthcare industries would mandate vaccine and healthcare would not. When that's our number one job. Medical ethics is really, really important. But not all medical ethical principles are equal, right? The number one medical ethical principle is we do not cause harm to patients or certainly cause their death. That comes before everything else. It comes before my personal choice. And that's what the principles we have to adhere to in medical ethics. And so that's what we've chosen to do. We've been in a deadly pandemic for 19 months. There are 680,000 Americans who have died. And we cannot contribute to that number, not a single time. One is too many. And so that's what we've decided to do. And it's okay if people are frustrated by that, a small number of people. I can understand that. And but that's the culture of what we do, and that's what we'll continue to do.